You run 4 times a week. Your last checkup was clean. Your doctor looked at your numbers, nodded, and used the word excellent. And you walked out of that office feeling exactly what you were supposed to feel. Say, but here is what that appointment did not check. Inside the arteries that carry blood to your brain, a slow and silent process may already be underway. It has nothing to do with how fit you are. It does not care how many miles you logged this week. It produces no pain, no pressure, no signal of any kind, until the moment it does. And by then, for too many people, the window to stop it has already closed. This is not rare. Stroke happens to people in their 40s who exercise and eat reasonably well. Many have been told repeatedly that everything looks fine. The problem is not that their bodies gave no warning. The problem is that the warnings came and went in minutes, and nobody told them what those minutes actually meant. In this video, I'm going to show you 3 things. First, why a healthy body can hide this kind of damage so completely. Second, the 5 warning signs that show up days before a stroke in people just like this. Signs that feel minor, pass quickly, and get explained away every single time. And third, the specific test to ask your doctor for by name, because the standard checkup will not find this on its own. And the 5th warning sign is the one that catches people completely off guard, because it has nothing to do with your head, your vision, or your balance. I will show you exactly what it is in a few minutes. Most people have a clear picture in their head of who gets a stroke. It is the elderly relative who smoked for decades. It is the person who never exercised, ate poorly, and ignored every warning their doctor gave them. Stroke, in most people's minds, is what happens when you stop taking care of yourself. That picture is not completely wrong, but it is incomplete in a way that is quietly dangerous, because it creates a false sense of safety in exactly the people who need to be paying attention. Here is what is actually happening inside the arteries that feed your brain. The inner lining of those arteries works like the nonstick coating on a good pan. When that coating is smooth and intact, nothing sticks to it. Blood moves cleanly. Everything flows the way it should. The whole system runs without a problem. But over the years, certain things act like metal utensils scraping across that surface. High blood pressure scrapes it with every heartbeat. Blood sugar that runs a little high, even in the pre-diabetic range, scrapes it from the inside. Chronic inflammation from poor sleep, stress, or a diet that is not terrible but not clean either keeps scraping it day after day without producing a single symptom. The coating gets rougher, tiny scars form, and on a rough, scarred surface, things start to cling. Cholesterol, platelets, inflammatory material that slowly builds and hardens over time. Not in someone who never exercised. In anyone. In everyone to varying degrees, depending on what has been happening inside their body over the last 10 or 20 years. The part that makes this so difficult to catch is that none of it hurts. The arteries have no pain receptors. There is no signal, no pressure, no early warning that any of this is building. The body compensates so well for early damage that a person can have significant buildup in their vessels and still run a 10K, still pass a checkup, still feel completely fine. Between 10 and 15% of all strokes happen in people under the age of 45. And in that group, the response after the fact is almost always the same. They had no idea anything was wrong. Not because they were ignoring their health, because nothing they were doing, and nothing their doctor was checking, was designed to find this particular problem before it became a crisis. But here is what makes this genuinely dangerous, and what most people, including most doctors at annual checkups, completely miss. Many people believe that if a stroke was coming, they would feel it building. There would be some kind of clear warning, more headaches, more dizziness, more symptoms getting worse over time. Something would slowly rise in the background and tell you that danger was getting closer. That sounds completely reasonable. Most serious problems in life give signals before they become emergencies. A small leak becomes a bigger leak. A weak knee starts hurting more often. We naturally expect the body to work the same way, but the brain does not always follow those rules. The blood vessels feeding your brain do not have pain receptors inside them. That means a vessel can slowly narrow and you may feel absolutely nothing. No pain, no pressure, no alarm. And what makes this even more surprising is that your brain is not passive while this is happening. When blood flow starts changing, the brain quietly adapts. It looks for other pathways. It reroutes blood around the problem and keeps important areas supplied for as long as possible. In many people, a blood vessel can narrow by more than half, while daily life still feels completely normal. Doctors have a name for this. It is called cerebrovascular reserve. In simple terms, it means the brain has backup ability. It can adjust and compensate when blood flow starts becoming a problem. And for a while, that backup system can work very well. That is exactly why people can keep exercising, keep working, keep feeling healthy, and still believe everything is fine. The body is covering for the problem. It is buying time without telling you it is doing it. But compensation can create a dangerous illusion. Because when your brain keeps solving the problem quietly in the background, you start believing there is no problem at all. So if the brain is compensating right up until the moment it fails, what actually triggers the failure? The answer involves a mechanism most people have never heard of. And it is the reason a symptom that lasts 8 minutes and disappears can be more dangerous than one that lasts 8 hours. Most strokes in younger, otherwise healthy people are not caused by an artery that has been slowly closing for years until it finally shuts. That is the version most people picture. It is also the slower, more detectable version. The one that sometimes does produce symptoms as it progresses. What actually causes most strokes in people under 50 is faster, smaller, and far harder to predict. A fragment of plaque or a tiny clot forms on a damaged section of vessel wall. It sits there attached, causing no symptoms and no disruption to blood flow. Then one day, under physical effort, under a spike in blood pressure, or sometimes under no obvious trigger at all, it breaks loose. It travels through the bloodstream until it reaches a vessel too narrow to pass through. It lodges there. The brain region that vessel was feeding goes dark. If the clot is small enough to drift and break apart, blood flow returns. The symptom disappears. The person feels fine within minutes. If the clot holds, the damage becomes permanent. That is the mechanism. And it is the reason a symptom that vanishes is not reassuring. It means the clot moved. It does not mean the problem did. Marcus was 42 years old, a committed cyclist, and had completely normal cholesterol levels. One morning he woke up feeling slightly off, a mild clumsiness on his left side, and his words coming out slightly wrong when he tried to speak. It lasted about 8 minutes. Then it passed. He felt normal. He assumed he had slept awkwardly or was coming down with something. He went to work. 4 days later, Marcus had a full ischemic stroke. What happened that morning was a transient ischemic attack, a TIA. A clot had briefly blocked blood flow to part of his brain had partially compensated, and then the clot had drifted before permanent damage could set in. The symptom resolved. The source of the clot did not. But this is the part people miss. The dress rehearsal and the main event use the exact same process. The only difference is that the first blockage moved. The second one didn't. And that is why symptoms lasting only a few minutes can become so dangerous. Because when something appears suddenly and then disappears just as fast, people feel relieved. They tell themselves it passed, so it must not have mattered. But sometimes the shortest warning is the one that matters most. And that brings us to the signs people ignore every day. Signs that often look small, harmless, or easy to explain away until later, when the picture suddenly becomes clear. Which brings us to the 5 signs that appeared before Marcus's stroke, and before many strokes in people this age. Most of them last under 10 minutes. All of them get dismissed. Here's exactly what they feel like, and what's actually happening inside when they do. The first sign can feel like someone slowly pulled a dark curtain across one eye. Not blurry vision, not tired eyes, not the feeling you get after staring at a screen too long. One eye suddenly dims or goes dark for a short time, and then the vision returns. What may be happening is that a tiny clot briefly blocks the blood flow feeding the retina, which connects directly to the same system supplying your brain. People often blame eye strain or standing up too quickly. But one eye, sudden, and temporary is a different category. Treat it as a blood flow problem until proven otherwise. The second sign is sudden numbness on one side. A hand feels strange. Part of your face feels heavy. One leg suddenly feels disconnected, like it belongs to somebody else. Not after sleeping awkwardly. Not after sitting in one position too long. It simply appears. This can happen when blood flow briefly drops to the area of the brain that handles feelings and sensation on that side of the body. Many people call it a pinched nerve. But pinched nerves usually follow movement or position. This appears without warning and often disappears by itself. Sudden, one-sided, and no clear reason should always get attention. The third sign feels almost like being drunk without drinking anything at all. You stand up and your body suddenly does not cooperate. A foot lands wrong, you miss the edge of a table. You reach for something and your hand misses. Maybe you grab a wall for a second and then, a minute later, everything feels normal again. The balance center of the brain depends on a steady blood supply. A brief interruption can create sudden unsteadiness that seems to come out of nowhere. People often blame poor sleep, stress, or blood pressure. But balance problems that appear suddenly and then disappear are not reassuring. They are warning signs. Signs 1, 2, and 3 all share something. And once you see what it is, you'll understand why the last 2 signs are even easier to miss. The 4th sign is speech that briefly breaks, not forgetting a word here or there. Words suddenly come out wrong. You know what you want to say, but the sentence does not cooperate, or someone speaks to you and for a few seconds their words stop making sense. Then just as quickly, everything returns to normal. Certain parts of the brain control speech and understanding. Even a short drop in blood flow can interrupt them. People dismiss this as stress or being tired. But if speech suddenly breaks and then comes back, it did not magically fix itself. Blood flow changed. And the 5th sign is the one many people never connect to stroke at all. A new headache that does not fit your normal pattern. Not your usual stress headache. Not the one you always get after a long day. This headache feels different. It shows up differently, sits in a different place, or arrives with one of the other signs we just talked about. In some people, especially those with autoimmune problems, inflammation can directly damage blood vessels and speed up the process that makes clots easier to form. Headaches are common. A headache that is new, changing, or showing up beside neurological symptoms is not. Remember the pattern: sudden, one-sided, new, act. And if it disappears in minutes, that can be more suspicious, not less. The brain does not send test signals for entertainment. Now here is the part most videos skip, because it is less dramatic than the warning signs. But it is the actual reason those signs happen in a 42-year-old who runs 4 times a week instead of someone who never exercises at all. The stroke at 42 did not start at 42. It started at 29. That sounds strange because most people think of a stroke as a sudden event. One moment everything feels normal, and the next moment something terrible happens. But what we call a stroke is often the final chapter of a process that has been running quietly in the background for years. The event gets your attention. The process is what built it. The first is blood sugar, and not just diabetic level blood sugar. Even in the pre-diabetic range, where glucose is only slightly above normal, the inner lining of blood vessels begins to take damage. The cells that make up that lining need insulin to absorb energy and maintain their structure. When blood sugar runs consistently high, that process gets disrupted. The cells weaken. The smooth surface they create starts to roughen and scar. And a scarred surface, as covered earlier, is where clots and plaque begin to form. This damage can be happening for 5 or 10 years before any doctor looks at a fasting glucose result and uses the word diabetes. The lining does not wait for the official diagnosis to start deteriorating. The second is blood pressure that is a little high, but never quite high enough to treat. Persistent pressure above 120 over 80 places physical stress on vessel walls with every single heartbeat. Not occasionally, continuously, roughly 100,000 times per day. Over years, that repeated stress creates tiny tears in the vessel lining. The body patches those tears with inflammatory material. That material hardens over time. The vessel becomes stiffer, narrower, and less able to handle sudden changes in flow. This is not a dramatic process. It is slow, mechanical, and entirely silent. The third is chronic low-grade inflammation. The kind that does not come from a single obvious source, but builds from a combination of things. Processed food, poor or inconsistent sleep, unmanaged stress that never fully resolves. Each of these keeps inflammatory markers elevated in the bloodstream. And that persistent inflammation damages the endothelium, the vessel lining, directly, on its own, independent of cholesterol levels and independent of blood pressure readings. A person can have clean numbers across the board and still be accumulating vascular damage through inflammation alone, which brings up something worth saying clearly. A normal blood pressure reading at your annual physical does not tell you the condition of your vessel walls. It tells you the pressure at one specific moment on one specific day. The walls themselves remember every year of elevated pressure, elevated glucose, and elevated inflammation that came before that appointment. One clean reading does not erase that history. A stroke at 42 is not bad luck. It is the last page of a story that started being written in someone's 20s. Here is what changes everything about this. And it is the part of the stroke conversation that almost never gets mentioned clearly enough. There is one piece of good news in all of this, and it matters more than most people realize. after a transient ischemic attack, one of those short warning episodes where symptoms appear and disappear. There is often a window of roughly 72 hours where doctors can still identify the cause and interrupt the process before a larger event happens. That window matters because many people think the danger ends when the symptoms end. It doesn't. The reason is simple. The same problem that caused the first event is usually still there. The clot source is still there. The unstable area in the blood vessel is still there. The narrowing is still there. The body does not suddenly repair itself because symptoms faded away. The clock for the next event starts the moment the first one ends. That is what makes these short episodes so misleading. People feel symptoms disappear and instantly feel relief. They think, I'm okay now. They tell themselves they will watch it for a day or two. Maybe rest. Maybe see whether it happens again. Now, when people do decide to act, there is one mistake that comes up repeatedly, and it comes from a genuinely good instinct. The person suspects a clot was involved. They know blood thinners help with clots, and so they take aspirin before going in. It feels like doing something useful while waiting for care. The problem is that there are two completely different types of stroke. One is caused by a blocked vessel, ischemic. The other is caused by a vessel that is bleeding, hemorrhagic. In a hemorrhagic stroke, taking aspirin does not help thin a clot. There is no clot. There is a bleed. And aspirin makes that bleed faster and larger. The two types are clinically impossible to tell apart without a brain scan. They can produce overlapping symptoms. No one, not the person experiencing it, not a bystander, not even a doctor without imaging, can reliably distinguish between them from the outside. The one decision that changes the outcome is getting the scan before starting any medication. Not aspirin first, then imaging. Imaging first, then the right treatment for the right type of event. So, when you get there, what do you actually ask for? Because Check My Brain is not a test. Here are the 3 specific things that will tell you what standard care alone will not. There are 3 specific tests worth asking for by name. Not because they are exotic or hard to access, but because they look at the parts of the picture that a standard checkup leaves blank. The first is a carotid duplex ultrasound. This is a non-invasive scan of the arteries in the neck that carry blood from the heart up to the brain. It takes roughly 30 to 45 minutes, requires no needles and no preparation, and it shows 2 things simultaneously: the physical structure of the artery wall and the speed and quality of blood flowing through it. That combination reveals whether narrowing is already severe enough to be restricting supply to the brain. Your annual physical does not include this test. It will not be offered unless you ask for it by name. The second is an HbA1c, glycated hemoglobin. This is a blood test, but it is fundamentally different from the fasting glucose reading most people have had at a standard checkup. A fasting glucose tells you your blood sugar level on the morning of the test. An HbA1c reflects your average blood sugar over the previous 3 months, because glucose molecules attach to red blood cells over time, and those cells can be measured. You cannot produce a good result by eating well the day before the draw. It catches the kind of consistently elevated blood sugar that damages vessel walls for years before anyone applies the word diabetes to it. If you have never had this test, or if it has been more than a year, you have a gap in your vascular picture. The third is a Holter monitor ECG. A standard ECG at a clinic records your heart rhythm for about 10 seconds. If atrial fibrillation, the rhythm disorder that allows clots to form in the heart and travel directly to the brain, only occurs a few times a day, a 10-second snapshot will miss it completely. A Holter monitor is a small recording device worn for 24 hours while you go about your normal routine. It captures every heartbeat across the full day and flags any irregular rhythm that the clinic snapshot would never see. Many people with intermittent atrial fibrillation feel nothing unusual. The monitor finds what they cannot, and before any appointment happens, there are 2 things you can do right now. If you have ever had one of the warning signs we talked about, even briefly, even 6 months ago, write it down. Write the date, how long it lasted, which side of the body it happened on, what you were doing when it started. Those details matter more than people realize. Because without them, you are describing a symptom. With them, you are handing a clinician a map. A stroke at 42 is not a random event. It is often the final scene of a process that spent years building quietly and days warning clearly through signs that lasted minutes and then disappeared. Your job is not to wait for paralysis. Your job is to recognize the minute. And if someone in your life keeps saying, "It passed, so it's probably nothing," send them this video. Because with stroke, That sentence is exactly how people lose the only window they had.